Yeah, so starting to see some good signs as we get into spring, Kieran. So the curve continues to bend in New South Wales, despite 4 more coronavirus deaths on top of 13 yesterday and more than 50 deaths in the past week. 935 new cases today in New South Wales. The first time in a month the daily figure has been below 1,000 cases, way below the peak of 1,599. And the number of cases when the government opens things up matter, because there is debate over how much to open up at 70% double dose vaccination as opposed to 80%, the Doherty Institute in New South Wales Health Advice says. And as I just mentioned, it's a very polarising debate given the strains on jobs and mental health from the lockdowns. Let's talk about the vaccination rate in the outbreak states. In New South Wales, the first dose figure is 82.2%. meaning the prospect of hitting as high as 85% double dose looks possible. The second dose figure, 52.7%. Another 1.8 million jabs needed to hit 80% double dose. If it could be managed that you could deliver 100,000 second doses a day in New South Wales, or about 1% a day, if some of those second doses can be brought forward, there's no reason you couldn't get to 80% double vaccination within about 3 weeks or so, or October 11. I know Craig Laundy was on the program with Kieran saying it's $1.01 for reopening of pubs on October 18, by the way. It's now $1.01 for October 11. So think about that. It looks like just 3 weeks to freedom for the residents of New South Wales. And you'll have further coverage in that a lot of 12 to 15-year-olds will be vaccinated as well. 20% of them have already had a single dose in New South Wales. But let's have a look at the ACT. The first dose rate is 80.36%, the second dose rate 55.93%. But in terms of opening up, Chief Minister Andrew Barr wants to count the 12 to 15-year-olds to come up with the 80% reopening figure, when the Doherty Institute says you don't have to. So that will delay reopening. That's bad news for the people of the ACT. In Victoria, the first dose rate, well, it's a lot lower, isn't it? 72.7%, fully vaxxed, 44.2%, basically the national average. So there is some way to go there. Victorians need to get cracking if they want freedom back. One issue in the differential rate of vaccination is New South Wales got more Pfizer from the federal government, but another reason is the Victorian outbreak started later, so they are catching up on the rush to vaccinate. But still, it's clear more Victorians need to go and get vaccinated. And I think Anthony Tassoni, the Victorian Pharmacy Guild president, summed it up best today when he said that people should not wait if they can only get AstraZeneca. They should get whatever vaccine is available.
It sometimes can feel like in this pandemic that we're on a plane spiralling and plummeting towards the earth. And when I look under my seat for the life jacket, I'm not preferencing the red or the yellow one. I'm getting what's there. When the oxygen mask drops down, I don't want the blue one with the blue tubing or the green one. I grab what's there. The best vaccine that you can get is the one you can get today.
On Friday, we were informed as a National Cabinet that there's some issue with supply. That means don't wait. Get the one you can get now. Astra, we've got plenty of that. There's even some Pfizer appointments, as I just said, that are not booked yet. But you've got Moderna coming on later in the week. Get what you can get now.
In New South Wales, it is clear at 70% vaccinated people will have more rights than unvaccinated. It is unclear what the New South Wales government is doing on that front at 80%. But here is a statement that came out over the weekend from the Doherty Institute, which helped devise the national plan. It makes clear that the strain on the hospital system will be much less at 80% vaccination coverage than 70% if, like in New South Wales, there are thousands of cases. The statement, released quietly on Saturday, reads, "The modelling consortium considered 3 levels of case numbers at the time of transition of Phase B, low tens, approximately 10 to 100, medium, which is hundreds, approximately 300 to 1,000, and high thousands, between 1,000 and 4,500 active infections. In the majority of cases, the model's conclusions were unchanged, with one important exception. If transitioning to Phase B at the 70% coverage threshold, seeding of thousands of infections in the context of partial effective test, trace, isolation and quarantine, with only baseline public health and social measures, resulted in earlier and larger outbreaks. While vaccine rollout continued throughout all the simulations, in the time window between 70 and 80% coverage, the epidemic was still growing from thousands to tens of thousands. As coverage increased beyond 80% coverage, the epidemic came under control. It goes on to say that much less impact of the overall size of epidemics was observed when those seeding scenarios, tens, hundreds and thousands, were introduced from the 80% coverage time point. It is therefore recommended that case numbers continue to be strongly suppressed through Phase B until 80% coverage is reached. So it seems clear there that they prefer an 80% opening or a bigger opening at 80% than 70%, Kieran. But here's the good news on that in terms of Sydney at least. It looks like Melbourne's a couple of weeks behind. From my calculations, and this is very rough, it looks like 70% double dose about October 5, which means a reopening on October 11. And then it looks like 80% double dose around October 15 or 16, which would really be quite extraordinary. But our senior producer, Tom O'Brien, has booked himself a dinner date on October 18. I think he should be changing that to October 11, Kieran.